Rheumatoid arthritis. Rheumatoid arthritis is a long-term progressive and disabling autoimmune disease. It's also a systemic disease, which means it affects the whole body. It causes inflammation, swelling, and pain in and around the joints and other body organs such as lungs, heart, eyes, kidneys, and blood vessels. The disease most often begins between the ages of 30 and 50. However, rheumatoid arthritis can start at any age. About 75% of rheumatoid arthritis patients are women. It occurs when a person's immune system mistakes the body's healthy tissues for foreign invaders. As the immune system responds, inflammation occurs in the target tissue or organ. Rheumatoid arthritis affects the lining of joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. Causes. The cause of rheumatoid arthritis is not known. It's an autoimmune disease. In an autoimmune disease, the immune system mistakenly sends inflammation to your own healthy tissue. In rheumatoid arthritis, the immune system's antibodies attack the synovium, which is the smooth lining of a joint. When this happens, pain and inflammation results. Eventually, if left untreated, it can invade and destroy cartilage. Hence, the tendons and ligaments that hold the joint together can also weaken, and the joint eventually loses its shape and configuration. Risk factors. Factors that may increase your risk of rheumatoid arthritis include age. Rheumatoid arthritis can occur at any age, but most commonly begins in middle age. Sex. Women are more likely than men to develop rheumatoid arthritis. Family history. If a member of your family has rheumatoid arthritis, you may have an increased risk. Obesity. People who are overweight or obese appear to be at a somewhat higher risk. Smoking. Cigarette smoking increases your risk. Environmental exposures such as asbestos or silica may increase the risk. Diet. Eating a lot of red meat and lack of vitamin C may increase the risk. Symptoms. Rheumatoid arthritis usually affects the hands and feet first, but it can occur in any joint. The main symptoms are joint pain, swelling, stiffness in more than one joint. Joint stiffness, especially first thing in the morning and after sitting still for a long time. Fatigue, low fever, loss of appetite, weight loss, loss of function, symmetrical joint involvement, joint deformity, dry eyes and mouth, and rheumatoid nodules which grow beneath the skin in places such as the elbow and hands. As the disease progresses, symptoms often spread to the wrists, knees, ankles, elbows, hips, and shoulders. In most cases, symptoms occur in the same joints on both sides of your body. Small joints in the hands and feet are most commonly affected. Rheumatoid arthritis signs and symptoms may vary in severity and may come and go. During a remission, they can disappear or they can be mild. However, during a flare, they can be severe. Over time, rheumatoid arthritis can cause joints to deform and shift out of place. Diagnosis. Early stages of rheumatoid arthritis may be difficult to diagnose as it can resemble other conditions. However, early diagnosis and treatment are essential to slow the progression of the disease. There is no one blood test or physical finding to confirm the diagnosis. A diagnosis of rheumatoid arthritis is based on your symptoms, a physical examination, and the results of X-rays, scans, and blood tests. During the physical exam, your doctor will check your joints for swelling, redness, and warmth. He or she may also check your reflexes and muscle strength. If you have rheumatoid arthritis, your doctor will refer you to a rheumatologist and may arrange blood tests to help confirm the diagnosis. Blood tests. People with rheumatoid arthritis often have an elevated erythrocyte sedimentation rate or C-reactive protein, which may indicate the presence of an inflammatory process in the body. These tests are not specific for rheumatoid arthritis and can occur in other inflammatory conditions or infection. Anemia. Many people with rheumatoid arthritis also have anemia. Anemia happens when there are too few red blood cells in the blood. Other common blood tests look for rheumatoid factor and anticyclic citrullinated peptide antibodies. About half of all people with rheumatoid arthritis have rheumatoid factor in their blood when the condition starts. However, around 1 in every 20 people without Rheumatoid arthritis also test positive for rheumatoid factor. People who test positive for anti-CCP are very likely to get rheumatoid arthritis. X-rays and scans may be used to check for joint inflammation and damage. MRI and ultrasound tests can help the doctor judge the severity of the disease in the body. Treatment. There is currently no cure for rheumatoid arthritis, but treatment can help to reduce inflammation, pain, and prevent damage to the joints. There are many ways to treat rheumatoid arthritis. There are medication, physical therapies, occupational therapy, counseling, and surgery. Medication. Medication can help to relieve symptoms and slow disease progression. Painkillers can help to relieve the pain caused by rheumatoid arthritis. Some can be bought over the counter from a pharmacy, while some are only available on prescription. Non-steroidal anti-inflammatory drugs reduce pain and inflammation. Long-term use of high doses can lead to side effects such as stomach irritation, high blood pressure, kidney and liver damage. Disease-modifying anti-rheumatic drugs can slow the progression of rheumatoid arthritis and prevent permanent damage to the joints and other tissues. It is most effective if a person uses it in the early stages, but it can take from 4 to 6 months to fully experience the benefits. Side effects may include liver damage, bone marrow suppression, and severe lung infections. Corticosteroid medications such as prednisone reduce inflammation and pain. Corticosteroids can help with acute symptoms or short-term flare-ups. Long-term use of corticosteroids can have serious side effects. Side effects may include osteoporosis, weight gain, and diabetes. No single treatment works for all patients. Many people with rheumatoid arthritis need to take more than one drug. This is because different drugs work in different ways. Occupational therapy. An occupational therapist can help you learn new and effective ways of carrying out daily tasks. This can minimize stress on painful joints. He will work with you to find different ways of doing things and help you find which types of activities are best for you and at what level or pace you should do them. Assistive devices can make it easier to avoid stressing your painful joints. Relaxation. Finding ways to relieve mental stress may help control pain. Examples include meditation, guided imagery, deep breathing, and muscle relaxation. Surgery. If medications fail to prevent or slow joint damage, doctors may consider surgery to repair damaged joints. Surgery may help restore the ability to use the joint. It can also reduce pain and improve function. Rheumatoid arthritis surgery may involve one or more of the following procedures. Synovectomy involves removal of the synovium if it is inflamed and causing pain. Tendon repair. Inflammation and joint damage may cause tendons around the joint to loosen or rupture. If tendons have loosened or ruptured around the joint, surgery may help restore them. Joint fusion. Surgically fusing a joint may be recommended to relieve pain and realign or stabilize a joint. Total joint replacement. During total joint replacement surgery, surgeon removes the damaged parts of the joint and inserts a prosthesis made of metal and plastic. A number of strategies can help a person to manage rheumatoid arthritis. Patient education, such as how to cope with rheumatoid arthritis, is also important. Exercise. When symptoms are mild rheumatoid arthritis, patients are encouraged to do low-impact aerobic exercises such as walking and exercises to boost muscle strength. The best exercises are those that do not strain the joints, such as swimming. This will improve the overall health and lower the pressure on the joints. Rest. When a flare-up occurs, the person should rest as much as possible. Overexerting swollen and painful joints can make the symptoms worse. At these times, doing gentle range of motion exercises such as stretching will keep the joint flexible. Diet. Following a varied diet with plenty of fresh fruits and green leafy vegetables can help a person to feel better and maintain a healthy weight. Applying heat or cold. Hot water pack or electric heating pad can help relieve pain. Make sure these items are warm but not very hot, as it can cause burning or scalding. A towel should be placed between the heated item and the skin for protection. Ice packs. Cold items on the joint can relieve pain and muscle spasms. Using an ice pack can help ease the joint pain. Complications. People with rheumatoid arthritis have a higher risk of some conditions, including heart disease. Rheumatoid arthritis can increase the risk of hardened and blocked arteries. Atherosclerosis is the most common cardiovascular manifestation in rheumatoid arthritis. It is also the leading cause of death in the rheumatoid arthritis patient. Other conditions include carpal tunnel syndrome, rheumatoid nodules, dry eyes and mouth, recurrent bacterial infections, osteoporosis, vasculitis, and inflammation. People with rheumatoid arthritis have an increased risk of inflammation which can affect the lungs, heart, blood vessels, eyes, and other parts of the body. Depression, anxiety, stress, and employment difficulties are common due to joint pain and deformity. Rheumatoid arthritis is a painful and chronic condition that can cause joint damage and make it difficult for a person to carry out their daily tasks. Anyone who experiences pain and swelling in two or more joints should see a doctor, as early treatment can reduce the risk of long-term problems. Thank you.